Welcome. I'm Doug Morgan, and you're listening to Uncommon Sense, where we hunt for the truth in the topics you're not supposed to talk about, Christianity and politics. Obamacare, or as many people know it as, the Affordable Care Act, or ACA, was passed in March of 2010, believe it or not, with President Barack Obama signing the Patient Protection and Affordable Care Act into law on March 23rd of 2010. Yes, it was that long ago. Kind of makes you feel old, doesn't it? Well, there was not a single Republican vote cast for that bill. It was all on the Democratic Party. Obamacare was a takeover of over 17% of our nation's GDP. We're talking about the economy, from private industry to national governance, a national healthcare type system. Not total, not everything is on the government, but it was a takeover of over 17% of our nation's GDP. The liberal Democratic Party wanted the national healthcare system, but they couldn't get the votes for it. They couldn't get the support from Americans for that kind of system. So they came up with the Obamacare system instead. Obamacare was designed to fail. That's what they said. That's what many said from the get-go. It was designed to fail. The idea was that when it does fail, people will then want a national healthcare system. And now that we're 15 years later, we are seeing the effects of this system that was designed to fail from the beginning. George Caldwell, who writes for the Daily Signal, says, as Congress debates whether to extend Obamacare premium tax credits, a new report from the Government Accountability Office reveals the subsidies are prone to fraud and sometimes go to dead people. The office, which is funded by Congress, revealed on December 3rd of this year that the Obamacare marketplace initially approved coverage, you got to hear this, for 19 of our 20, so all but one, fictitious applicants. So they sent in 20 fictitious applicants, and they approved 19 of them for the 2025 premium tax credits in an audit of the Centers for Medicare and Medicaid Services. Quote, it is an eye-opener, Speaker of the House Mike Johnson said. He told reporters that the report backs up his advocacy for reforming the premium tax credits that Democrats have demanded to extend. Quote, it makes clear why it would be a dereliction of duty, as he put it, to just extend subsidies without massive reforms to them. The government report said coverage continued for months for these phony enrollees. Quote, as of September of 2025, coverage for 18 fictitious enrollees remained active, is what the report reads. The results of our covert testing for plan year 2025 are generally consistent with results of similar testing we conducted for plan years 2014 through 2016. The report additionally found $94 million spent in premium tax dollars towards customers whose Social Security numbers were associated with a deceased person in 2023. The analysis of 2023 data identified over 58,000 Social Security numbers that received a premium tax credit despite belonging to people who were marked as deceased in Social Security Administration death data. This is approximately 0.42% of the Social Security numbers that received a premium tax credit that year. They were flat out fraudulent. They were going to dead people. According to Johnson, the Obamacare exchange and insurers didn't verify any of the information they were supposed to under the law, and they proceeded to pay tens of thousands of dollars to insurance companies for people who do not exist. In fact, Rachel Gressler, who also writes for the Daily Signal, continues on by saying, no one spends a dollar better than the person who earned it. That adage reveals the crux of massive fraud and improper payments that plague federal health insurance programs and drive up costs for taxpayers. According to a report from the Government Accountability Office, the one we were just talking about, more than 95% of the fictitious applicants the GAO created and attempted to enroll in Obamacare were approved and enrolled. The insurance companies received thousands of taxpayer dollars per month on behalf of those fake enrollees. The details of the GAO report revealed the utter negligence and perverse incentives that result when federal government puts taxpayer money up for grabs for people who didn't earn it. That includes the agents and brokers who receive commissions from insurance companies when they enroll individuals, real or fake. It doesn't matter. If they can enroll somebody, real or fake, they get the money. And they have to enroll them in this federal marketplace healthcare plan. Now, most Obamacare enrollments are assisted by an agent or a broker, and it includes the insurance companies that can receive upwards of $10,000 per year of taxpayer money for every individual, again, fake or real, enrolled in their plans. For instance, out of the 4 fake applicants GAO sought to enroll in 2024, last year, 2 were initially flagged by the system's automatic identity checks, but later cleared after submitting fictitious identification documents, including fake citizenship documents. In the other 2 cases in which the GAO worked with brokers to enroll fake applicants, the system, the brokers used initially flagged the applicant's social security numbers as unverified, which is what it should, right? But after the GAO's fake applicants authorized their brokers to work toward enrollment on their behalf, quote, both brokers worked with the marketplace call center without the applicants. Okay, it was just the brokers. They said, hey, brokers, can you get this done? They went on to the marketplace call center and they, without the applicant, to successfully submit the applications with invalid social security numbers. The GAO noted of its false enrollment applicants and attempts that we either were not requested to provide the federal marketplace with documentation or generally did not provide what was requested. Yet, our 4 fictitious applicants received subsidized coverage. So either they weren't requested to give anything more and they just enrolled them, or they requested, say, hey, we need these kind of documents, and when they did not provide them, they enrolled them anyway. Sometimes Obamacare's fraud detection systems not only failed to detect fraud, but manufactured false verifications. So it wasn't just not getting the fraud; the system actually manufactured false verifications, as the GAO noted. Quote, in one case, we received a notice from the federal marketplace that it confirmed the applicant's estimated income based on documentation we submitted. However, we did not submit documentation to confirm the applicant's income. In another case, the most basic check. So again, what I'm saying, what is being said here is that they didn't submit this documentation, and yet the system came up with it anyway, or came up with something anyway. In another case, the most basic checks are ignored. Social security numbers provide a unique identifier, both to prevent fake enrollment through stolen social security numbers and to ensure the accuracy of Obamacare payments based on income that is linked to the social security numbers. Yet, when GAO examined the the reconciliation of income data from the tax records to Social Security numbers, it could not identify evidence of such reconciliation for 32%, or that translates to $21 billion with a B of all tax credits paid in 2023. Moreover, while an applicant's Social Security number should serve as a basic check to make sure that the same individual or fake Social Security number or stolen identity isn't enrolled more than once, the GAO nevertheless found more than 29,000 Social Security numbers that received more than 365 days of plan coverage in 2023, and more than 66,000 Social Security numbers that were similarly enrolled more than once in 2024. In the most egregious example, one Social Security number was used to receive subsidized insurance coverage for over 26,000 days. That's over 71 years of coverage across over 125 insurance policies in a single year. So basically, the same Social Security number was used over and over and over and over and over again, and it was used so much that it added up to 71 years of coverage in a single year. Over 125 insurance policies is what that Social Security number was on. The GAO also identified over 7,000 instances in which the Social Security numbers of individuals enrolled in Obamacare in 2023 were for individuals who were identified in the Social Security Administration's death files with reported death dates prior to enrollment applications. Payments were nevertheless made to brokers and health insurance companies for these dead Obamacare enrollees. In addition to fake and fraudulent enrollments, the GAO report also noted that brokers often act illegally to make changes to individuals' insurance plans, typically changes that will result in payment from an insurance company to the broker without their consent. The GAO identified at least 160,000 applicants, or 1.5% of relevant applicants, that likely had unauthorized changes made to their plans in 2024. This aligns with the Centers for Medicare and Medicaid Services statement, noting that it received more than 90,000 complaints in the first 8 months of 2024 from individuals who had their Obamacare plans changed without their consent. Unfortunately, fraud, abuse, and improper payments are not contained to Obamacare. They are rampant across the federal government and have been growing exponentially alongside the massive expansion of federal spending. Last year alone, the federal government identified $162 billion in improper payments among the programs that it examined. But that's a massive understatement, as the government often fails to properly audit programs. For example, we found that Medicaid's reported improper payments are half their more realistic total of $1.1 trillion over the past decade. There is plenty that lawmakers can and should do to protect the integrity of taxpayer spending. That includes not extending what were supposed to be temporary COVID-19 subsidies that have exploded in costs and further subsidized insurance companies' profits. And it ultimately requires right-sizing the federal government, because the more opportunities fraudsters have to steal taxpayer money, the more they will take, of course. And it's not even just simply about the money, even. George Caldwell also says that as Republicans in Congress debate whether to extend the COVID-19 era healthcare premium tax credits, a prominent conservative organization is warning lawmakers not to abandon pro-life priorities. The Advancing American Freedom Foundation memorandum, titled "How Obamacare Subsidies Pay for Abortions," lays out a loophole in the Patient Protection and Affordable Care Act, Obamacare, which which allows for taxpayer dollars to subsidize abortions. Quote, while the legislative text of Obamacare says that an insurance plan shall not make any amount attributable to the federal tax credit to pay for abortion services, the legislation allows the subsidies to fund plans that cover abortions. Yeah. So the money can't go there directly, but it can go to plans that cover abortions. As written today, DC and 25 states allow ACA plans to cover abortions. The state loophole makes the existing abortion funding restrictions toothless. I mean, there's no need for it even in there. It blocks nothing when it comes to abortion. Advancing American Freedom was founded by former Vice President Mike Pence, and at the end of the year, COVID-19 era boosts to premium tax credit levels passed under President Joe Biden are set to expire, and that's what they're fighting over in Congress right now. House Republican leaders' new bill, set to hit the floor this week, would allow the expiring enhanced credit levels to revert back to pre-COVID-19 levels. The baseline credit would remain, but it would go back to those levels. Now, House and Senate Democrats, as well as a handful of Republicans in both chambers, have expressed support for a clean, short-term extension of the current credits. But there are some Republican proposals to overhaul the premium tax credit system, many of which involve things like creating flexible health savings accounts, equivalent to the benefits of the credit. So basically, giving you an account that you can draw from for healthcare purposes, and it's not going to cost the government not one more dime, because the money they would be saving on these tax credit things would be going to you as having a healthcare flexible savings account. Now, Speaker of the House Mike Johnson told the Daily Signal Tuesday that he still supports instituting flexible health savings accounts as the alternative to premium tax credits, despite this not being in his current healthcare package. But it's very much on the table. The president likes the policy as well. Johnson told the Daily Signal, he says that I think we could get broad consensus on that. Johnson also previewed a potential budget reconciliation bill, a type of legislation that only requires a simple majority of both chambers to tackle the issue. And he said that, quote, what we anticipate going into the first quarter of next year is probably in a reconciliation package or a regular order standalone, ideas just like this, he said. Vice President J.D. Vance also told the Daily Signal on Tuesday at a rally in Pennsylvania that he would favor an overhaul of the Obamacare system, tax credit system. He said that we have the weirdest health care system in the world, where we tax money from all of these great Americans out here, and then we give boatloads of money to the insurance companies. Why don't we give that money to the American people and let them buy insurance that works for them and their families? I mean, it's a good question, right? Well, it's, again, not just simply about the money. In fact, let me give you a little bit of detail here as far as how Obamacare has affected the healthcare system in general, and doctors and that type of thing. In fact, this is from Dr. Ashley Womack, who is a Dallas native and board certified OBGYN, and she writes, "Do no harm. It's one of the first principles of ethical medical care, dating back to the ancient Greeks. But political pressure and a false understanding of patient autonomy have instead forced physicians to violate their patients' dignity and their own conscience. It's a troubling paradigm shift in modern medicine, especially in the OBGYN field. Physicians are reduced to simple service providers, dispensing whatever the patient requests, rather than practicing thoughtful, evidence-based care. Consequently, prominent institutions, including the Accreditation Council of Graduate Medical Education, now disregards physicians' fundamental right to act in accordance with their moral principles and true care for their patients. As a devout Catholic whose conscience rights were violated during residency, I know firsthand the restraints medical institutions impose on physicians and healthcare workers. That's why, she says, I'm urging Congress to pass the Conscience Protection for Medical Residents Act, co-sponsored by Representative Greg Murphy, the Republican from North Carolina, and Senator James Langford, the Republican from Oklahoma, to help shift medicine back to its founding principles. Throughout my medical training, my goal was to be a pro-life voice in the OBGYN world and treat both patients, the mom and the preborn child. I specifically avoided programs and agnostic to my beliefs and hospitals that required I train to perform abortions. The University of Texas at Austin seemed like the perfect match. It assured me I wouldn't be pressured into anything that violated my conscience. In reality, the opposite happened. During my second year of residency, I anticipated my scheduled rotation at the local Planned Parenthood with deep reservations. Other residents with the same objections to abortion were forced to go in the past, so I felt pressured to go as well. The entire experience violated my conscience and what I knew to be good and true for patients. I went to my assistant program director, who was the abortionist in charge of the rotation, asking to opt out. Initially, I was told this would not be possible, but if I insisted, I would have to discuss it with the department chair. I insisted. Eventually, I was allowed to opt out if I could create an alternative chair-approved curriculum. For a weekend, I traded my student hat for my teacher's hat, hoping that by Tuesday, I could opt out of Planned Parenthood. In the end, an alternative curriculum was never approved. And since I refused to go, I was assigned reading material to complete in the residency office. My story only scratched the surface of a systemic problem that has been going on for years. The ACGME's political-driven opt-out abortion training requirement has threatened the conscious rights protections that we physicians need to have to practice medicine effectively and ethically. This opt-out criterion puts medical residents in an intimidating, career-threatening position, leaving them no choice but to challenge mentors who control grades and provide training opportunities that could impact their future in the medical field. Coercion in the medical field should be highly discouraged. Yet, in the same name of autonomy, medical bodies like the ACGME and the American College of Obstetricians and Gynecologists make an exemption for abortion. Never mind that 76 to 93% of OBGYNs don't perform induced abortions and are already trained to treat miscarriages and ectopic pregnancies. ACOG aggressively pushes for standard and mandatory abortion training regardless, alienating a significant portion of medical community. A 2016 study found that more than half of physicians identify as faith-based, with 65% believing in God. Yet ACOG and ACGME show little concern for excluding them. In fact, another study conducted just before the Dobbs versus Jackson Women's Health Organization decision in 2022 revealed that nearly 25% of medical program directors have a negative view of students who refuse to conduct abortions based on deep moral convictions. The result? Well, the OBGYN field ends up shrinking under the weight of politics dictating medical training. Now is the time for physicians dedicated to medicine's founding principles to act, she says. In my letter to Attorney General Ken Paxton about the Coates-Snow Amendment on elective abortion training, I quoted former Senator Olympia Snowe, the Republican from Maine, one of its co-sponsors. Her goal was to protect those institutions and those individuals who do not want to get involved in the performance or training of abortion when it is contrary to their beliefs, while still maintaining strong medical training standards. That's the gold standard. Politics should protect scientific truth and ethical principles, not warp them. Now, thanks to Murphy and Langford, we have the opportunity to revive it. Murphy, a fellow physician and co-chair of the GOP Doctors Caucus, also saw ACGME and ACOG's unchecked authority and political opinions in medicine. His leadership, inspired by the American Association of Pro-Life Obstetricians and Gynecologists, have helped turn this bill into a reality. Instead of the current opt-out model, this bill would replace it with an opt-in model, respecting the rights of physicians to practice according to their conscience and ethical medical approach. True conscious rights protections are upheld, and medical residents can choose without fear of retaliation. She says, I will always do my best for my patients. I will do no harm. Many other physicians agree. And it's time for Congress to stand up and create safeguards to shield the medical field from political agendas. America's medical students, physicians, and mothers depend on it. I mean, this is a result of Obamacare. But I also say, don't complain without a solution. So recently, on the Senate floor, the U.S. Senate Finance Committee Chairman Mike Crapo, who's the Republican from Idaho, called on his colleagues to support the Healthcare Freedom for Patients Act legislation to lower healthcare costs and give money directly to families to control their own healthcare. He also discussed Obamacare's failures, including the rampant fraud caused by the enhanced Obamacare health care subsidies, and explain why a straight extension of this program will do nothing to lower costs or premiums or protect taxpayers. He said Obamacare is broken, and throwing good taxpayer money after bad policy is not going to fix it, he said. The enhanced premium tax credits amount for only about 4% of next year's projected 20% increase in insurance premiums. Next year's 20% increase in insurance premiums. Extending them will not solve this crisis. What it will do is cause tens of billions in more dollars to be paid directly to insurance companies without improving patients' care or choice. So on fraud in the Biden COVID bonuses, the taxpayers footed the bill. These subsidies give insurance companies every single reason they need to keep hiking premiums. and thus we see fraud based out of that. On the Healthcare Freedom for Patients Act, Senator Cassidy he says, and I have a different plan. The motivating principle is simple. Patients should decide where their healthcare spending goes, not insurance companies. And I would agree totally with that. In fact, I think there was a time when I didn't have a whole lot of I and my family did not have health insurance. And so what we did was we went to doctors, and we went to doctors' offices, and we said, look, I need a checkup or whatever. How much, if I pay you cash, how much would it cost me to do that? And the discount that they gave for cash was considerable. And there's a whole reason for that. We don't have time for that today. But when you have control over your healthcare system, and instead of an insurance company type of scenario that is just simply sucking off the government and the government taxpayers, then you're going to get this type of system. And Obamacare is a failure. It was designed to be a failure. It was supposed to be a failure so that people would then clamor for national health care and where the government funds everything and nothing is up to us, which is failed miserably where it is enacted. And so we've had a very good healthcare system when the government gets out of it. We've had the best in the world when government isn't interfering. And I think we need to get back to more of that than what we have now under the Obamacare system. I don't know. I'd love to hear your thoughts on it. Of course, you can always do that at uncommonsensepodcast.com. And thank you for listening.
This podcast is a production